And we've talked about change and transformation all day. And this is change and transformation in action. So without further ado, I want to introduce our first speaker, Sir David Dalton. He's going to be talking about our digital future.
Thank you very much, John, and welcome. Great that you got back from tea. And I have to say, we've heard some fabulous presentations today. We really have. And I love some of the messages about authenticity, accepting that we don't know everything, and therefore we ought to expose our vulnerability. The talk that John gave about behaviours, teamwork, partnership, really thinking about what that means. So what I hope to do is weave some of that into my presentation. So I'm not sure how I drive this. Is it a clicker from here? It is. Okay, so I'm talking to you about digital and what the future may have in store for us. I'm aware that I could talk about a tomorrow's world type of presentation, show you all the technology that exists, the great things that are happening around the world, and indeed I will mention a little bit of that. But my talk is much more about thinking what is the potential for Greater Manchester. John said that we were lagging, and we are, compared with many other parts of the country, and we don't need to. We actually know, I think, what it is that we can do. So we've got to get pace, we've got to get reliability, and we've got to be able to get benefits at scale. Now, we can use that technology that is available to us. We don't have to test it or necessarily invent it for ourselves. And we know that we can enable people to be doing things quite differently from the way they do things at the moment. And we can redefine our relationship with the people who use our services and the people we are providing services for. We also know there's been a huge amount of money that I think has been wasted in technology. The NHS is one of those few industries where digital, unlike others, hasn't reduced the cost of production. It's actually increased it for the moment. But the potential is there, and that's what I want to talk about. So we either have much of this already in Greater Manchester, or we can go to places we know where digital solutions are across the world. So what we have to do is to organise how we bring that into the conurbation. But we have to look through a different lens, and the lens we have to look through is not our own as providers of services, but it's through the lens of the person we're providing services to. So we have to see digital as redefining that relationship, shifting the power from the supplier, the provider, to the consumer, the user of our services. And that is fundamental, I think, in what digital enables. For too long, I think, when you look back in the last decade, it's been about technology, IT, electronic patient records, where the beneficiary is the provider. We now, I think, are on the cusp of seeing something quite different in redefining that relationship. So, how does Greater Manchester make this happen? Well, I think that it has to look hard, be serious, and I hope come to the conclusion that what we need are common standards that can operate across Greater Manchester. And whatever we do with our data, we have to have at the forefront of our mind that it's going to be open access, not closed. Many of our systems are closed because they provide benefits to the provider. Open access is quite different. It allows applications to interact with that data in quite a different way. What Greater Manchester cannot do is provide Betamax over here and VHS over there and spend 10 years trying to sort out which is the best one. We've got to be able to create those common standards, that interoperability, and have our data as open as possible. So we are on the cusp, a real cusp of change that will be irreversible. You can go around the world and see pockets of this, and I was fortunate with colleagues to go and visit Salford a couple of months ago. And you can see in California what is happening, what the potential is. And we know that it won't be too long before Greater Manchester is experiencing that too. But whatever we do, it has to be reliable. And with reliability comes a prize. It's the prize of removing the variability that we have in the way that we provide services to people. It means that our services can be of a consistently high standard, whatever the day of the week and whatever the hour of the day. And digital is a huge enabler for that. But it can also help us reduce our costs quite dramatically. So I happen to know in the organisations I have a responsibility for that we employ more than 4,000 administrative and clerical staff at band 5 and below. We spend £54 million on their salaries. And a lot of those people, the majority of those people, are servicing our processes, and they're doing their job very diligently, but they're servicing our processes, and digital can be doing that for us and can be often providing a better service. What we have to do is sense make everything that we're putting in place. And sense making it often means that you have to create the opportunity to visualize what's happening for people to make more intelligent decisions. This is a whole separate presentation looking at each one of these components. But we are able to do that. And we're able to do it, I think, if we coalesce leadership in Greater Manchester and get our design right and allow our organisations to submit themselves to the authority of that design leadership. If we want to get on and progress, that is what we have to do, and we have to organise it. Now, we're fortunate that we have one of the NHS's designated centres for, don't like the term global, but digital excellence. What we have to do is to make sure that we use that centre to provide the leadership and make sure that what that centre doesn't do is feather their own nest. They have a responsibility, I have a responsibility, for making sure that we can do a lot of this design work, we can identify those standards, and we can make those benefits available for all. Now, some things we're testing out, they're not to stay in Salford, they're there then to be utilised rapidly. So the first control centre, we are already now able to interact with all of our doctors in training, to look at their work, how it's scheduled, and be in contact with them, to alert them of tasks that perhaps they would have put in a different order of priority that we would like to be done differently. So that's version 1 of the control centre that has started. We're testing now, and in a few weeks' time we will be able to support clinical decision makers in how they take decisions for people with fractured neck of femur. We know the pathway, and so do they. We can predict what it is in their decision-making process, and we can alert them, prompt them, and we can guide them into the tests and decisions that they have to take. So let's see how we can develop these particular arrangements, because if we don't do it, we will be looking back in 10 years' time. We will see many other parts of the country steaming ahead, many other countries in the world outclassing us by a country mile. They really will be. And yet we have the potential in Greater Manchester to organise ourselves in a different way and to commit ourselves to common standards of design for digital, and commit ourselves to be open with our data and to share it with our users, so that they can interact with their wearables, their Fitbits, all of the other technology that is available. It is for them to interact with their data, and we can then support them in the choices that they make. So, huge opportunity available to us. Let's just grasp it and take the sensible decisions now before it's too late. Thank you.